So there's been a lot of talk these days about vaccines. You know, since the entire world is battling a pandemic right now, a vaccine would be our golden ticket out of this mess. But here's the kicker. The science tells us that it would only work if almost everyone had access to it. Otherwise, it's kind of pointless. Let me explain. So you've got the world, right? And yes, we are living in the Catan universe because why not? And here are all the people infected with the virus, aka COVID-19. And it's, you know, everywhere because global pandemic. So say we develop an effective vaccine and start giving it to people, but there's a catch. It's either not affordable, there's not enough of it, or people refuse to be vaccinated. So only some people get the vaccine. But still, a lot of people are vaccinated, at least in these areas, and people stop getting sick. Hooray, life can go back to normal, right? Wrong. We live in a super globalized world where people and objects travel a lot. And if there's one thing we've learned from the COVID-19 pandemic, it's that diseases don't respect borders. So let's just say one person with COVID-19 boards a flight, or in this case, a spaceship. If they're coming from an area with low immunization rates, chances are pretty good that they could infect 2 people en route. And even if they land in a country with relatively high vaccination coverage, some people will still be vulnerable to infection. Pretty quickly, 2 people can infect 4 people can infect 16, and so on until we've got a second wave of outbreak on our hands. This isn't a crazy scenario to imagine. Last year, 4.5 billion people traveled by plane alone. That's a lot of people moving around. When it comes to public health, we know that the poorest and most vulnerable people often get left behind. This is a challenge even under normal circumstances. Typically, there's a lag of up to 7 years from the time a new vaccine becomes available in a developed country to the time developing countries have access to it. This is why when we eventually do have a vaccine or treatment, it must be available to all people, regardless of their nationality or wealth. Because if coronavirus is spreading anywhere, it's a threat to people everywhere.